Hi friends, I'm Dr. Sarah Nelson, here to talk to you today about IBD or inflammatory bowel disease in cats. This is one of my favorite diseases in cats and one of the most common. And the reason I like it is because I do a lot of abdominal ultrasound, and that is one of the ways we look for this disease. So this video today is going to be a broad overview of everything I can think of that I might tell a cat owner about IBD. Of course, this is going to be very broad and cover a lot of different situations, so it's not going to be specific to any one cat. In the real world, I will be picking and choosing from this information and other factors to make a plan for each cat. So what is IBD or inflammatory bowel disease? It's when inflammatory cells come into the intestinal walls. So all that inflammation in the intestinal walls, it can cause a variety of different symptoms. Sometimes the only symptom we're going to see is weight loss because food is just passing through the intestines. That thickening and inflammation in the walls is not allowing nutrients to absorb, and the cats will just lose weight without really any other obvious symptoms. Lots of times we'll see chronic vomiting, so not just the occasional vomiting that a cat might do every 6 months or so, but if your cat starts vomiting more frequently, a couple times a week or even several times a month on a regular basis. Some cats will also get diarrhea or even constipation. Kind of depends on where the inflammation is affecting along that intestinal tract. Now, all of these symptoms are pretty vague and they can look a lot like other diseases. So we can never make this diagnosis just based on symptoms. Things like kidney disease, hyperthyroidism, parasites, even diabetes can sometimes look very similar. So we definitely need to do some testing to figure it out. This is a disease that mostly affects older cats, but I have seen it affect young cats, even 1 or 2 years old. There can be some overlap too with food allergies that can look very similar to IBD and can be pretty difficult to distinguish. So how are we going to diagnose IBD? Number one is going to be to rule out other diseases. So as we talked about, IBD can look a lot like other diseases in cats. So we definitely need a full blood panel with a CBC, chemistry, and thyroid or T4 test to make sure we rule out some of the most common diseases, especially in older cats. And then a fecal parasite test to make sure there's no parasites, things like Giardia, hookworms, roundworms, depending on where you live. These can be more prevalent. Once we've ruled out other possibilities, we need to start looking at imaging, so actually trying to see the intestines. Number one way to do that is going to be an abdominal ultrasound. This is a really nice test because it's not invasive. We might have to shave the fur on your cat's belly. They just have to lay on their back and we can look at all of their internal organs with the ultrasound. This way we can actually see the intestines and the intestinal lining, and there's often a thickening of a very specific layer called the muscularis that happens in IBD. However, this is not a specific diagnosis. This is a change that's consistent with IBD, but can be present in other diseases, most common of which is lymphoma. We're going to talk about that a little bit later. Other things we're looking at on the ultrasound are the abdominal lymph nodes that can be enlarged with IBD or other diseases. And we're also trying to just rule out other problems in all the other organs. And the only way to get a true diagnosis of IBD is going to be an intestinal biopsy. This can be done either with an endoscope, where they put a scope down the throat into the intestine and take some little samples from the inside of the intestine, or it can be done surgically, where they actually cut into the abdomen, take out a piece of intestine, and take a full thickness biopsy. However, even with a biopsy, unfortunately there can still be some gray areas and a lot of overlap between IBD and intestinal lymphoma. So this is something that's very specific to cats. They have a form of small cell lymphoma, which is luckily a more non-aggressive form of lymphoma, but it is still a cancer. It can look very similar to IBD even on a biopsy. And we actually think there's kind of a spectrum where IBD can turn into lymphoma. It can be a mix of IBD and lymphoma, so it can be really difficult to diagnose. Also, small cell lymphoma, which is the one that looks very similar to IBD, actually also has very similar treatment to IBD. So in some cases, we don't end up doing those biopsies, and if we find changes on the ultrasound that could be consistent with either IBD or a small cell lymphoma, we might just decide to go ahead with treatment without knowing which one it is. I'll briefly mention this small cell intestinal lymphoma is different than large cell lymphoma, which is a much more aggressive form. This is usually going to look different on the ultrasound and not going to be as easily confused with IBD because large cell lymphoma tends to cause tumors in the intestine. Small cell lymphoma is usually not going to do that. And large cell lymphoma tends to cause really more dramatic changes to the lymph nodes in the abdomen. So sometimes we can use that to help differentiate. So once we did the ultrasound and we're suspicious of either IBD or a small cell lymphoma, then we're going to start treatment. So depending on how severe the changes are, how severe the symptoms are, we might start with just a food change. Getting the cat on a very specific diet, either hydrolyzed protein diet, which is kind of super hypoallergenic, where all the proteins are broken down into the tiniest particles so that the cat does not recognize it as anything to have a reaction to. And that will also help with food allergies if that's part of it. And in some cases, I won't do that hydrolyzed protein diet. I might just do a GI support diet. So a super bland, easy to digest food that maybe has some added probiotics and things like that. It's going to depend on case by case. One of the most important things in most cases, though, is a consistent diet. So if you're changing up the food all the time, that can be irritating to the intestines when they're inflamed. Most of the time for medications for IBD, we're going to be using steroids, which is either prednisolone or budesonide. So prednisolone is a general anti-inflammatory steroid that's going to affect the whole body. Budesonide is a very similar medication, but it is a little more focused on the GI tract. Prednisolone can be administered as a pill, liquid, or even a transdermal ear gel. Budesonide is usually going to be something oral like a pill or a liquid. And then the other most common medication we're going to use is called chlorambucil. This is actually a chemo medication. It's usually given as a pill, sometimes liquid, but it can be given pretty infrequently. So usually just a couple times a week, or even I have some cats taking it once a week. And it is a chemo medication, so we have to take into consideration the owners in the house, make sure people are using gloves when they administer it, but it is often really helpful. And especially in the cases of small cell lymphoma, or when we're suspicious of that, we're gonna end up using chlorambucil with the steroid. Whenever we start a cat on a long-term steroid, prednisolone or budesonide, we have to think about the risk of developing diabetes. I'm not going to go into the details of that right now, but any cat on a chronic steroid is at risk of developing diabetes. So you have to watch for things like increased drinking, increased peeing, losing weight. Those are signs of diabetes, and we want to make sure cat owners know about that when they're starting the medication. Along with medication, we often end up needing supplements or kind of supportive medications along with that. One common thing that cats with IBD will have is a deficiency in vitamin B12. And just like in people, this can make the cats feel a little lethargic or low energy, so supplementing the B12 can really help them feel better. This can be done as an injection or as a pill, and studies have actually shown that even with that intestinal inflammation, the pills still do absorb well, and so it is okay to do either way. Another supplement I'll often use is fiber. There's several different types of fiber that can be used for different things, but it can help with constipation or diarrhea, depending on what type of fiber we use. Lots of times that's going to come as a powder that goes in the food. Probiotics are another one that can help. Lots of times with IBD, that intestinal flora, the bacteria that's good in the gut kind of tends to get really off balance. So giving the gut back those good bacteria can really help. That usually comes as a powder as well, but it can also be a paste or a pill depending on the situation. And while we're getting cats started on treatment with, special diet, with the steroids, maybe chlorambucil, lots of times they need some extra support for the symptoms that are going on. So anti-nausea medication is going to be one of the most important, stopping that vomiting so the cats just feel better. Most of the time for that, we're going to use meropitant, also called Cerenia as the brand name. That can be either a pill, or what I like best is an ear gel. Just helps them feel so much better. It's really easy to give and very safe. Another common symptom of IBD, although not all cats have it, is going to be low appetite. And we do have a couple of medications that can help just stimulate the appetite, make them feel more hungry, to get them eating, get some food in their system, and that can really help them feel better. So for that, we have either mirtazapine, which is usually an ear gel, though it does also come as a pill, or we have Allura, which is a name brand liquid that's given once a day. So what should you expect if your cat gets started on treatment for IBD? Expect a lifelong treatment with special diet, or at least a very consistent diet, trying to avoid giving them things that are going to upset their stomach, and expect lifelong medication for a lot of these cases. Not every cat needs medication, especially if it's mild or we catch it really early, but a lot of them end up being on a lifelong either steroid or chlorambucil or both. And depending on whether they have IBD or small cell lymphoma or somewhere in between, those medications may be tapered down to a lower dose over time, or maybe increased to higher doses or adding on medications over time if things are slowly getting worse. However, in both these diseases, I do tend to see the cats live many, many years of good quality life. Lots of times as they're older cats, they have concurrent illnesses as well, like kidney disease, heart disease, things like that we're managing along with it, which can make things a little more complicated. But the IBD often does get pretty well controlled with medication. They do tend to get flare-ups over time, and just expect that occasionally they might need to go into the vet to get, fluids, supportive care to get through a flare-up, but usually they will be able to come back down again. The main things to monitor at home are going to be weight. That's probably number one, making sure that your cat's not losing weight unintentionally. So either by bringing them into the vet for frequent weight checks or getting a baby scale and checking their weight at home. And then control of symptoms, of course, so that stopping the chronic vomiting or the chronic diarrhea or constipation or whatever was the original symptom. And as far as monitoring at the vet, we are going to most likely recommend checking the ultrasound over time. So maybe after the first few months of medication, I'm going to want to see if the intestines are going back down to normal and no longer looking thickened. And then depending on the situation, maybe every 6 to 12 months, we might recommend another ultrasound as a follow-up to make sure things aren't getting worse. So I really hope that's helpful information about IBD. Thank you for watching, and I will see you next time.